So today it was not one of those times. So
Well, we feel very lucky.
I switched our
let's
monthly,
not overstate that, but I'm glad to be here.
we had to switch our monthly staff meetings because of this meeting.
Really now? Well,
Well,
Now I have no excuse.
some of these are ones I don't have control over as much, but anyway, but thank you.
we feel very special, Sheriff Nole, that you switched your staff meeting.
I said it was a meeting that I must attend.
Okay, we decided to forego introductions because we feel like everybody knows everybody. I'm going to just check in. I thought I'd check in first with the school because those are generally the folks that have to come and go the quickest. So Trish, if there's anything that you want to bring to this table or that you guys need that you wish we were thinking about, and now I'm not just thinking South County harm reduction, I'm thinking South County whatever. Whoops, you might be on mute.
I may be totally off focus. I think COVID things are calmer and smoother, and we have what we need there. I think we're on a path to getting some counseling services again. So I feel, and from a county standpoint, Greg, if we have the new modular building that they're getting our final inspections on, and all that's going well. So I mean, I think we're kind of good,
Okay. Anybody have anything more to say or respond to there?
I just had, now Trish, you're down in Brennan, is that right? And I don't know if you can talk about this, but I knew there was a little outbreak or something with students and COVID.
Well,
all under control now. And
it's been very quiet for 2 weeks. It's funny, we've learned some lessons. If you test a lot, you find a lot, and we tested a lot. Probably if you lined people up in front of the, wherever and tested a bunch of them, you're going to find a bunch. Our kids didn't know that they didn't feel sick. They were mostly asymptomatic. But two things hurt us. One girl that shouldn't say one kid that she just doesn't stay where she's supposed to be. She's everywhere and doesn't stay in her seating charts, and she's hard, She came down with COVID, and that kind of created some challenges. And then I think we had a birthday party with kids that are in school. It was a family party, but in Britain, when you have a family party, that means you got cousins and sisters and they're in the same class, and boom, that kind of happened. So we had COVID there. And so we did a lot of testing, and then we had families that, we had 3 families that they worked at the school, and one of their kids came up positive, and they just sort of said, well, we're going to rip the Band-Aid off. We're all going to go home. There's no way I can quarantine from a little kid. So that created a little bit of a bloom, but I'm holding my breath. We've continued to test and look and be careful. And we haven't found any more cases in the last, week and a half, or I don't know how long it's been. It's been quiet. And we just sort of keep wearing our masks and keep up with our seating charts and our bus charts. And we loosened up breakfast and lunch a little bit to where we had more space there. And so, and our families are really great. We could have had this huge social media blow up with all kinds of bantering, and we just didn't. They just brought their kids to school and followed the quarantine rules and didn't fuss and have a fit about it. And, they're just good. So
I heard about it because one of our corrections officers has at least 1 or 2 kids that go there. And
right. They were one of the ones where, how do you quarantine from your little kid? I mean, that's right. So that's exactly right. You did have that. And so it worked its way. And then the crazy quarantine rules, which I'm not arguing with, they're good. It's like, if you're not vaccinated, then your quarantine starts when the last person gets over theirs. And so, it's a lot. So they just kind of ripped the Band-Aid off and said, we're going to have COVID here. So I'm not saying that person.
Yeah, good job working through that. And
well,
we
also
didn't get called any protests at the Brennan school. So
also really Apple and Dr. Berry, no one's shaming me. They're saying, you guys are really doing a good job. You're doing the best you can. I say, I promise we are, I promise.
Absolutely. I'm going to chime in and just reiterate what Dr. Berry has said. Maybe not to this group, but Brennan School District had all the things in place. They are following all the infection control mitigation strategies. Trish is steeped in this stuff, and she's got a real, strong connection within the school and within the community, and all those things overlap a lot in Brennan. You have teachers or assistants at school who have kids in the school, and then those kids go to a birthday party, and then that person's family. It's just it's like a snowball, especially in a small community. So the blessing and the curse is that it snowballs quickly, but you have quick access to your people because they know you and they come to you and they listen to you, and they have your attention. And you did great.
Thank you. Thank you. We were well supported, and hopefully the bump is behind us, but we did learn it's very contagious. I mean, it's just, we try to do everything right and it's still very contagious. So thanks for your support, Apple, and for your whole department. They were, super, super helpful, super supportive. And then even Dr. Berry, when she talked about the situation at the county commissioners, she didn't do it in a shaming or slapping on the hand manner. She said, this is what Apple's saying. So we didn't get the hit that we could have had, so thank you.
Well, since we're talking about the greatness of Trish right now, I just want to say that I wouldn't expect anything less. And part of that is I've used your name a couple times at some meetings I've been at where it's like, where's the schools at? And I say, well, I don't know. I said, but that superintendent down in Brennan, she comes to the meetings and stuff. So I really
thank you.
Appreciate that. I've been around long enough to know that, and I know schools and teachers have a hard time in keeping their schedules and all that, but schools seem to not be at all the meetings that they should be at, I think. And I'm not that I'm advocating meetings, but that's one thing I've noticed about you since, I don't know if you first came here or what, I knew it was a meeting at the hospital where I met you, that you seem to keep your fingers in the pie, and that's really good. My 2 cents worth.
Thank you. Thank you.
Right.
Yeah, thanks. I have a question and then a small update too. So I'll ask my question first. And that's, it's great to hear that mental health counseling is probably coming back. I've heard a little bit from Commissioner Eisenhower. I don't sit on those groups, but I guess I'd love just a little update about the talks with ESD. And is that pretty much just waiting for signatures, or what's going on with the mental health counseling in the school?
And you can correct me if I'm wrong. I had one meeting about that, but I think that the 0.1%, that funding is good. The ESD is going to manage it somehow, and they're good at that. I mean, they manage lots of programs like that. So now it'll be a matter of course, finding good people, but I think they'll also be good at that too. They just got a big reach, and so I'm hopeful that will be really successful. So
Absolutely. Yeah. So there's a special BHC meeting coming up. We were supposed to have one this week, but it unfortunately couldn't happen. And so we're going to have one next week. I'm getting some clarification from Anna on that. I think there's probably some more work to do with the OESD to get the contract worked out specifically. And we're in talks about that all the time, but it's a process, as you know. And so I believe it's okay to say, but I think the pitch at the special meeting next week is to perhaps use some of the emergency funds that the 0.1% has to tide over placement of the mental health counselors for at least the next 11 weeks while we get the OESD situation sorted out. It's going really well. As you said, Trish, they have all the parts that make contractual work and oversight and hiring and allocation of funds easy through them, because that's their wheelhouse for sure, and they're eager to do that in Jefferson County. So I think that's going to work out smoothly. What's hard is that the wait and not knowing what parts of the process or the piece of the puzzle are being worked on, because we're not doing that in such a huge public way. That can feel disconcerting because you're waiting for a service that was needed yesterday. I mean, that's an understatement for sure, but it's happening. I promise.
That's great. That's really exciting. It was so frustrating to hear about the balking of MCS. But and then my update, just because this is something that I think was brought up in this group about transportation, Jefferson Transit and South County specifically, but schools in particular. I was at the JCEP meeting with Denise a couple weeks ago of all the superintendents, the quarterly meeting that Trish was dealing with an emergency we've already discussed with, so wasn't there. But it came up about the interest from the superintendents, at least, to get some representation on the Jefferson Transit Board. And this is something that we can open up, I believe, only once every 4 years, and I haven't had an opportunity, or it happened right after I was elected. But we did talk about it in the Board of County Commissioners, which is a little difficult because we also constitute a quorum of the Jefferson Transit Board. And of course, that is what the commissioners would lose if we brought more members in, is we wouldn't be the deciding agency anymore about all things Jefferson Transit. And I think that we're all fine with that. We really work through consensus building rather than just kind of throwing the weight around anyway. So I think as we go forward, I might ask this group and specifically the school districts and maybe the fire districts as well to lobby the Jefferson Transit for opening that up and having a conversation about maybe adding more elected officials. And there's some question and interpretation from Jefferson Transit, I think, historically, that elected officials from school boards wouldn't qualify for the board. So there's conversations to have and some vetting to do of the process. But there's many transit boards that include a more expansive membership, and that's how I'm approaching right now, trying to include some of the more rural parts of our county in the Jefferson Transit policy making. That's it.
Thanks, that's good to hear. Any thoughts, comments, insights, questions on that topic? How about Denise? Do you have any updates that you'd like to share with the group?
Well, by now everybody knows that Quilcene has an Empowered Teens Coalition, and they hired their a student assistance professional through the ESD, and they have 1 day of counseling in the schools right now using MCS counseling. And we went down yesterday or last week. Wait, maybe it was yesterday, Tim. Holly came down and met with you to discuss the Empowered Teens Coalition. And I believe that she brought the yellow cards with her. Yes, okay. And then she also visited with the school and left yellow cards there also. And those are the cards that have all the contact information for any kind of assistance that you might need regarding alcohol, tobacco, and other mental health issues. And then in Chimacum, talking with Scott, the new superintendent, they really are thinking that they're just going to add days for Rebecca, their counselor through MCS, and pay for themselves while they have their fingers crossed that emergency funding will come through the 0.1%. And then also that the contracts will be soothed and smoothed out and engaged through the ESD. And so they're very helpful, and they're going forward to add more counseling in the school on their own dime, hoping that they'll get paid back. And because they're going to use funds, ESSER funds that they already sort of had allocated to something else. And so the Empowered Teens Coalition pays for 1 day of counseling down there. And then they're hoping that they're going to just go ahead and add a few more days because they've had their counselor through MCS allocate some time to it. Yeah, so that is happening. And then on Saturday, we have the drug take back event, and it's in 3 locations this time. So Sheriff Nole and I will be in Hadlock, and then Holly and someone from the Sheriff's Department, Joe, I don't know who you have assigned to that duty yet, will be in Quilcene. And then Lindsay Scalf and someone from the police department will be at the Safeway in Port Townsend. Our Guiding Good Choices 5-week workshop begins November 1st, and those are, there's 2 of them being offered. People can choose to come on Monday nights, or people can choose to come on Tuesday nights. It's 5 weeks all through November, and it's electronic, so it's virtual. So people from wherever, if they have an internet connection, can join. And we have sent those flyers out broad and wide. We've done some advertising. We have, reader boards, advertising, and advertising through the radio station, and flyers that we've put up on bulletin boards, et cetera. So hopefully we'll get some people. We only have 2 right now, and that's always the problem, whether they're in person or virtual. We have trouble getting people to sign up. So, and it's a really worthy workshop, because it teaches the social development model, which is a really amazing prevention model. So
I can attest to it. I took it as a parent when I have a 12-year-old now, but he would have been just turning 11 when I took it. Super influential to me in my sort of frameworking around how to talk to a super naive little boy about what would come, in middle school, and has sort of, had its impacts on rearranging how we have family conversations about, what is out on the playground. What are people offering you a chance to know about after, cross country is over for the day, places where I can't be. The curriculum is about setting up decision making in the mind of the young person at this juncture, in this decision with these peers. What are my parents saying to me in my head about how to take the next step? Would they agree with what I'm about to do? And it's more about trust and supportive communication about how to make decisions with risk analysis in your mind, which is hard for little people.
Yeah.
It's hard for adults. We're doing risk analysis in COVID every day, all day.
Mhm.
And we're fatigued of it, and we run up against hardships and figuring out which risk to take or not. But it's great to have that kind of education when you're 11, even if it's just a little seed of it. So I highly recommend it. I wish it did get more traction. I wish more people would come, and I'm not sure what the answer is, but
Well,
it's not for lack of promoting it.
Yeah, we just keep offering it, and hopefully at some point it catches on. Greg, you had your hand up.
Yeah, we were thinking about doing it this year, actually. Mondays and Tuesdays are a little tough, but it's hard to find online. If I type in Guiding Good Choices, Jefferson County, I get old ones. I eventually get to the newspaper article that doesn't have a link. The Jefferson County Public Health. If I go to Jefferson County Public Health, Empowered Teens, I can get to it, but I think a little bit of search engine optimization might help.
Okay, all right. So we know we've posted it on Facebook and boosted it, right? So paid to have it boosted. But yeah, thanks for saying that. You know that you can reach it through the leader calendar also. So, but yeah,
I found it. I think you should be able to type in Guiding Good Choices,
Yeah.
Jefferson County, and find it. And I couldn't.
On that note, with the folks that are represented here in the different parts of the county, this is a question that's general, but it applies to things like Guiding Good Choices as well as other opportunities for people and families. And that is, Trish, in your school district, do you have an electronic bulletin board? That's a term. I don't know if that's what you call it, but it's a thing that pings you and says, hey, parents, there's a new message about what's going on in school. Do you have an approximation of that? I know in Port
Well, if you
Townsend.
ask about the electronic bulletin board, Greg can tell you we have a really nice marquee.
We have a nice LED screen. Yeah.
Yes.
Oh, I see. You mean a physical one. I mean,
Yeah.
a virtual.
It's interesting that you asked. We have a system that was never used much, but I'm having training on something tomorrow. My administrative assistant and I are getting trained on something new we're going to try. So
Great.
So that's where we are.
Just for emphasis, in the sort of mobile way that families and parents and people who work a lot and also have kids in various systems, whether that's sports or COVID related, or where is WIC in my community, or let's say we do something around harm reduction in the future and we want to disseminate some lighter information to all parents. the digital bulletin board sort of has become this concept. I mean, I use it as a parent because it's in my district, but I wouldn't have naturally known to do that because
Yeah.
I'm kind of a Luddite, honestly, when it comes to things like
Oh,
that.
Well, we started an active social media page where we have it archived like you're legally supposed to. So our parents mainly, we get more traction there than we do almost any place.
I thought you might say that. So that's just good data to know for various places in the county.
Right.
You know, the quickest on the fly communication strategy for certain communities will be Facebook.
I mean, we
And
have
others.
we have our Thursday go home folders. Whenever you guys want a flyer that you want a physical copy
Good
of,
to
I always
know.
say the Thursday go home folders. We have the Facebook page. If we post a job there or in the newspaper, we get a lot more traction on Facebook. So
Got it. Okay.
And then yeah.
That electric bulletin board, that's good to know about. That could be used for emergency
Yeah,
notification too to
for
families.
sure. You betcha.
Absolutely.
Or even, you know, Guiding Good Choices is virtual. You can do it from Brennan, but you could see it on the physical reader board and might just trigger people to say, oh, I'm gonna punch that in on my phone while I wait to get my kid to come out of school and get in the car this afternoon.
For sure.
Other updates, Denise? Good. Okay, Sheriff Nole, did you have anything?
Well, first of all, I want to know what's going on with Denise Banker. I've heard stuff at meetings. Is what I really
That's
want
in
to
my
know
update.
is she still going to do drug take back? That's what no, but I heard you're moving to a different position.
Well, I think we're gonna let Apple do that update.
Okay, never mind then.
Best for almost last. Should I go next?
The lawyers say strike that. Okay, strike
For the
that.
record.
Before we go to that, I want to make sure Sheriff Nole has gotten all of his updates out.
Yeah, so all I wanted to say, and I don't think I've told this group here, but we got our Navigator grant again, this time for a full year. And we've actually gone with another provider, and that's Discovery Behavioral Health. And we're really excited about what they may be able to do. And the Navigator we have now is finishing up this month. And then we will, I think our plan is November 1st to be going live, if you want to say, with DBH. And we're going to maybe try some new ideas on how that's all going to be worked out and where the person may be housed and whatnot. But and I know too, as far as the fire districts go, you know, having access to the Navigator, we want to try to work that into. And so anyway, just I'm glad that it's still going. And thank you, Greg. Greg was on our RFP panel that got to go through that, and very wise. He's a very wise commissioner. Anyway, I think that's about all I have.
What's the outgoing?
And the drug take back.
thing?
And the drug take back. This will be interesting down in Quilcene. This will be the first time we've done it down there. It seems like there's something else going on in Quill on that day. I don't know if I saw that somewhere.
There is so much going on at Quill on Saturday. It's amazing.
It's a vaccination clinic down there.
That's
too.
what it is. That's right.
And a football game.
This Saturday?
And a football game.
On a football game, I was gonna say, football game.
They'll take the empty vaccine containers over to the drug take back. We can haul all their stuff off.
But is the Vax clinic at the football game is the question.
Oh,
Maybe
What's the name
nearby.
of the outgoing Navigator, Joe?
John Walsh.
Okay, so I was just trying to get my contact straight, so he won't be.
Oh, yeah. And you'd met him before, I think, and there's
Yeah.
some, anyway, it's going to be with a new person. So-
Okay, great.
After we go through updates, we'll talk a little bit about all of the movement that is coming down on the navigation front and sort of go back and
Okay.
forth a bit about what Brennan could use and Quilcene as well. But before we
Yeah,
do that, we want to get to,
That's all I have.
all right. Thank you, Joe. Apple.
Well, I'd like to welcome our new Community Health Division Director, Denise Baker. Step right up. So I did leave that position. Well, I'm still in it currently, but in my movement to a new position, we have invited and offered the job to Denise, another internal promotion, which I think is awesome. We're doing that a lot lately, and it feels really good, in my opinion. I think for some people it can be a little anticlimactic because it's not a brand new face coming in. And right now, during the pandemic, with our nose to the grind all the time, anything novel is like, ooh, ooh, ooh. But Denise, I just want to say to you, having felt that myself, that it is really epic and it's great work. And you have all these partners who will want to do all these great things with you. And you already have that taste of how that works. You're a huge part of a lot of these forums anyway. So it's not going to be a huge stretch in that regard. And I know that everybody here will be happy to have you in that role. It will leave a hole in their minds for where you've been because you're so present in that other role. But I know Denise is fully equipped to fill her position. We have a job announcement coming out and we have interviews that'll come up, and we will find the right person for Chimacum to take her place. And they'll have a lot of good mentorship. Denise isn't really going anywhere, so she'll be here to offer that from a different position.
So she'll be, you won't do the empowered teens anymore?
I will hand that job off to a new person, but as I say that handoff, that will be a very warm handoff. So I will be very supportive to that person and also continue to support Holly, who's brand new, and Lindsay, who's only been doing it for a couple of years. And so, yeah, I will continue to support that role. And I'll also continue to, support the understanding of that budget and contract, because it's a really difficult budget and we've got a lot of things changing up in our fiscal area too. So I'm looking forward to continuing to help out. And yeah, Joe, if nobody wants to do the drug take back, it'll still be me. I'll still come. And then
Maybe I could get out of it, but guess not.
no way.
No.
I just want to say, for what it's worth, spent many an hour standing in the wind and the rain with Denise, and I always thought that your talents were kind of wasted. So I'm really glad to hear that. And I don't, that I'm not exactly sure what it is you're going to be doing, but it sounds like you're going to be doing more, and I'm sure you're going to be successful, and I'm glad that you decided to stick around, however you want to think of that. Not that you were going anywhere, but and I like what I would say, it seems to me kind of the current trend of hiring from within. I don't know if that's old thought or whatever, but there's a lot of people that already work in our places that have the background and the knowledge. Somehow it seems like we always feel we have to look elsewhere. So good. I'll miss you in the other things, but yeah, I'm proud of you. Way to go.
Thank you. Thanks, Joe. Somebody in the office said, well, perseverance pays off. So, and I have been accused of being tenacious before. So I'm very happy that.
That's why I'm thinking I could get out of the drug take back and the Empowered Teens Coalition if you're not involved. You're too tenacious. You kind of remind me of another person that works at the health department named Laurie Fleming.
Well, we grew up in the same attic, so.
We did. Denise and I sure did. Yes, congratulations to Denise.
Thank you.
Before I switch over to the fire chiefs, I just want to check. We've got somebody who new is phoned in. Who is that? At 360-509-2503.
Yep, it's Laurie Tinker. I just joined you once again, having connectivity problems. I'm up in Canada, so I am sorry I disrupt the meeting by coming late, but I'm here.
Oh no, Laurie, we're very happy you're here. I thought it might be you, but I didn't want to presume it. Okay, so we'll come back to you in a minute. Chief Manley, is there anything that you wanted to give in terms of an update or needs or insights from Brennan area?
I don't know this.
I'm sorry, Chief Manley. I don't know why we get some sort of a filter on your voice when you come through, so we can't understand. And yes, as Sheriff Nole says, it's a little Mickey Mouse sounding.
I like it. I like it.
You might
So
call
when
in
you
on the
go back to
phone.
this, yeah, feel free to call in or type in the chat if there's something. In the meantime, I'm going to go to Chief McKern. Any updates from the Quilcene Fire Department?
Well, obviously here, we're going to be busy on Saturday. Yes, I've met with Holly and we had a great interaction, great meeting. I did bring to her attention the Narcan take-home program that we're going to start rolling out here pretty quick. And so I think we're super excited about that. We're definitely super excited about helping out in the school program, the one that Holly's putting on. And so I think that's great. Joe, is really excited about the Navigator program. I think we need a Navigator on the south end. I think that's going to be amazing. I think both Chief Manny and I speak that anything we can do to help with that, let us know. And anything we can do to keep things moving on that direction, we're doing great. So I'm pleased that when it comes to funding time, if you need a letter for the next funding cycle, please reach out, and I'm more than happy to write a letter. I'm sure Chief Manley would agree with the same thing. We'll kind of keep that program going as we go through there. So with that, that's what's happening in Quilcene.
Okay, we'll dig a little into.
I just want to add to that a little. Yeah. So I may be calling on you to maybe attend some meetings or something, or phone calls, whatever. But I've already let Jim Novelli know that we want to have the fire department included. So we'll figure out some way to make that all work.
Make it happen. We'll reach out. We're very happy to step up into the plate, whatever meetings you need and whatever support you need. And two is if there's a location, if he's your navigator's down at this end, why our coffee's always on and the bathrooms are always open. Those seem to be when you're in a location like this, they need to stop. And I'm sure I speak for Chief Manley, his coffee's always on and her tea's always on and using the bathroom. So
I think navigators might only drink tea. So
that's okay. That's we're all good with tea.
teapot on.
Yep.
Okay, do you want to try again, Chief Manley?
I'm afraid to.
There you go. Much better.
It's embarrassing when the sheriff teases you, you know?
Well, it's funny. I was sitting here, I was thinking, I really like seeing all your Mickey Mouse stuff back there. And then I couldn't believe it when you started talking. I thought you were playing a trick on us.
No. Yeah, I've already got 2 trips booked and ready to go. So we're having a good time going to Disney in April for spring break and maybe a little winter one in February. We'll see.
Well, it definitely caught to your computer. Any updates or needs that we can provide you with? Do you guys have yellow cards? Could we bring some down at Drug Take Back and hand them off to somebody down there?
So one of your people came down and saw me about a month ago. So we're all set there. And I just kind of wanted to reiterate what Trish was saying. You know, things are really looking good down here in Brennan. I think we've rounded a corner as our COVID numbers have really started to change. I really can't tell you the last time I transported a COVID patient, just to think about it. I'm sure if I thought really hard. And one of the nice things is our entire department, 100%, we are all vaccinated. So that was really good. It was a little blessing in disguise for me as an administrator. And then yes,
very good.
Yeah, and then the Navigator program, as the sheriff was just talking about a moment ago, has been a huge asset. And so, yeah, as Chief McKern had said, I'll be more than happy to write, anything. I'll do anything you guys need to help support that. We've used it a lot down here, just with the many different issues and mental health type stuff that's going on down here. So it's been great, and so we're very happy. Need-wise, everything's good. I think we're happy.
All right.
And then just a quick question, Apple, when did you come from Nashville?
When did I come from Nashville? How do you know I'm from Nashville?
Well, come on, I'm a Facebook stalker. Everything's on Facebook, social media.
Well, interestingly, I grew up there my whole life and all my family's still there, but I moved to Seattle in 1992, January 1. So I've lived in Washington more now than I lived growing up in my home state, but I'm connected to it every day.
Yeah, my oldest daughter lives there. She's 32, and she went to MTSU, and then she works for the Bill Hudson advertising agency right there in downtown Nashville. So
It's a great
I'm very
city.
familiar. Yeah, so it just caught my eye. That's all.
And I have no accent. And I resent that, actually being a Washingtonian now. I wish I had a Southern accent.
I'm from the East Coast. I'm from Boston, and
I hear
only
it a
when somebody
little.
else walks in the room can will it come out from the East Coast.
I would never have guessed that, Chief Manley, that you were from Boston. Never.
Yeah.
I love how these meetings reveal connections we did not know we
Yeah.
have, since I come from Massachusetts as well. It's interesting, all of the
Yeah,
ways.
I spent many a summer in South Boston, Quincy Market, all down there.
Uh-huh.
Those
Yeah.
were my old stomping grounds. It was fun.
Anybody
Well,
from
Apple,
Nebraska?
Apple
besides-
must have ran away from home and moved out here when she was like 14. Get striked out.
Well, I wasn't that young. 19. I did strike out. I went as far as, my mom always said, you really had to go as far as the ocean. I mean, on the West Coast, seriously. And by the way, you're living in an earthquake zone. To which I said, well, you get hurricanes all the time.
Mhm.
So I'm not safe anywhere.
I drove through Nebraska once, just for Denise. I drove through it once. I saw your one and only cell tower.
All right, well, now that we've established some commonality, Laurie Tinker, is there anything that you wanted to give us in the way of updates or insights or questions for this group before we go into? I just wanted to do some quick overview of the various navigator pieces that are coming down the pike.
No, nothing specific other than to say that wholeheartedly support the investment in navigators. I think we have seen the good that is done at the hospital, and I have seen the good that it's done across the board and across specialties. So very excited about the potential of the South County Navigator. And things are going a tad bit better at the hospital. Everybody's holding their breath and crossing their fingers and toes, but there haven't been any significant increases of COVID admissions. Continue to have pretty much a daily dribble of COVID positive tests, but so things, the ship may seem to be at least not pitching and yawing quite as much, but navigating on.
Okay.
That's about all I know.
Well, we're really happy you could be here. Thank you for making the time to be in here. You all may know Laurie is semi-retired. I guess that's what I'm going to say, because she's at this meeting, so she can't be completely retired.
No, it's my pleasure.
And we're really grateful also that Laurie and some of you folks on this call are going to be at the Behavioral Health Summit that happens next week on the 27th. So grateful for, it's such an important topic. And this is an important time for these groups to be coming together. And so thank you all for the support of Dr. Carlbaum and Chip as we pull that together. So I want to talk quickly about navigators and some distinctions that there are between a navigator program that is about to be funded by and come online, maybe as early as November, more likely a little bit later than November, and the sheriff navigator role that Sheriff Nole was just talking about. So the navigator role is what you have always seen interacting and the ways that it's been interacting. That might get upgraded now that the navigator role is being led by DBH. So there might be an opportunity for some evolution there. But this navigator program, it's called a Recovery Navigator Program. It's one of, it's a regional program of which we have one set up here in Jefferson County and then in Clallam and Kitsap as well. And these are funded through the SBH ASO. And this is funding that looks like it will, be of a more permanent nature. So it's not just a 1 year and then we're going to have to sort of hold our breath and figure out what to do next. That recovery, and I put together a slide, which I'm just going to show quickly so that you can see some of the specifics around that program. Okay, can you folks see the screen? Just let me get myself set up quickly here so I can see you guys too. Now, the Navigator program that DBH will be running as part of this regional effort, it's intended as a referral source for law enforcement and the community. Currently, it's going to be in a 9 to 5 timeframe, although they're working really hard to get something that goes beyond 9 to 5, because we all know that time frame after 5 is when you really need navigators. It's also intended more as a street outreach program. It's intended to fill gaps. It's intended to avoid overstepping existing programs. And it's to cohere all of these different navigator efforts that we have going on. And I think one of the most important distinctions that I want people to understand is that this is not a crisis program. This series of navigators, I think we've got, I'm trying to think, there's a project manager, there's a case manager, and then I think there's 2 outreach folks. So that's the team that will be working on this Jefferson County Navigator. And they're intended to get contact with folks way before we get to a crisis point. So if there are folks in the community, that we know need to be connected with services, they're not going to be the folks that you're calling when you're out there at the house and somebody is in a crisis moment at that time. They're going to be people that we're attempting to connect up with services and prevent us from getting to that point. And what I want to make sure is that as this program is getting going and Jim Novelli and his team are thinking about how it's going to work, that we make sure we really weave what's going on in the South County area with what's being planned there, so that what's being planned really steps up to meet some of the need that you folks know is there. So I'm introducing what the difference is and asking if there's any comments or insights or questions that you guys have that we can make sure to answer for South County, even before we've started to get this program up and running.
Can I add just one comment first? I've heard a lot about this too, and this is funding through the HCA, the Healthcare Association.
Comes through SBHASO, right?
Yes, but the HCA is making the rules, and they still, as of our Behavioral Health Consortium meeting, have not really set up the rules for this recovery navigator. So while I think we should identify how it can help South County and the rest of Jefferson County, there's going to be some top-down management that is beyond our control and that will guard.
Absolutely. Absolutely.
Really exciting.
I also think the best way to help ensure that the program is used correctly is to be very clear and firm about what the referral pattern, or not pattern, but referral pathway and sources for referrals are going to be, what criteria, what bar, and who can make these referrals to.
Absolutely. So I'm hearing clear flow, communication flow, clear communication about what the boundaries are that had not yet been determined as of our last consortium meeting, but making sure that that gets to the folks that are interested in this program down here in South County. Any other feedback or thoughts or questions we want to make sure are in the discussion? Sheriff Nole?
Yeah, I guess just to add, I'm excited that both our navigator and the recovery navigator are both going to be under DBH, and that it can be, like Greg said, there's probably going to be some rules, but we don't need no stinking rules. But how it can all be used together. I picture it all being kind of, figuring out what's the best way to use all these resources at our disposal to help people. And so I'm glad it's all going to be under one roof, and that we definitely all have the communication with each other. And so I think it's going to be, I have high hopes that it's going to be something really good.
I see Commissioner Brotherton and then Apple.
And I'll just throw in what I hope that it can be partly. And I've heard, talking to Judd, the city navigator, and John Walsh as well, the current sheriff's navigator, lamenting the lack of case management. And I hope that this recovery navigator can kind of fill in that gap and be someone, is a soft handoff that doesn't start an ITA proceeding, but can just kind of fill that gap that we've heard expressed from both the navigators that in the law enforcement.
And then Apple.
So Greg, you just answered my question. I'm a little late to this concept. Sorry for that. So just getting my footing here. But the case management part, having done it myself, and also been a crisis intervener in my own way as a nurse, those two roles are different, though they synergistically make sense for the person needing the assistance. Because it can feel like an emergent, come in an emergency and help. And then the help is there, but there's a gap between that emergency crisis intervention and then the behavioral components that come with that person then getting into services that are longer term and more robust and do take a different level of awareness and commitment on the part of the person who's in need of the help. So having someone to usher them there and to keep them there or help them stay there the best that they can is, it's a really finessed job. I would suggest, now that I know a little more, I probably don't need to ask the question, but I might now make a comment. I would suggest that education around what these different navigators are focusing on helps the public understand the terminology. When we get excited about a role that really fixes something or is really there for the people, we tend to use the word really ubiquitously ultimately. And that can be a detriment to the actual service because it gets kind of watered down, if you will. The word navigation to me is like key word in health promotion on all levels. But if we use the word too much in too many places, it loses its unique kind of scope. And I've learned in healthcare, especially around behavior change, that scope needs to be limited so that you can have expertise within the scope and not have scope drift, which then people naturally want to do to help out, but it waters down the product, which is the service and the support to the person. So navigator, I mean, our community is just getting used to the sheriff and the police department navigator and what that is. And I see those people as crisis intervention, which I think is what they're doing, right? And it's, they might need to do more because there hasn't been this other navigational component, but it'd be nice for them to scope back to their area of expertise and then have this collaboration with this other component.
And to add to what Apple is saying, the way that I'm hearing this is that this is more of a prevention intervention navigation, right? So whereas the crisis level navigation that Judd and the Sheriff's Department have been doing is when they show up at a scene. This is to take place prior to that. So it would fall into the same category on some level as the YMCA Tanya Barnett family navigator sort of position, where Tanya is connecting families in need with all sorts of resources, right? And so this would be Discovery Behavioral Health navigator connecting families in need or individuals in need with all sorts of behavioral health support systems and other support systems. If
Social determinants of health.
Okay, all right, great. So is that correct? Am I understanding that correctly?
Well, just I don't know if I'm going against Apple's idea, but you know, some of the talks we've already had with Jim Novelli at Discovery Behavioral Health is, and you know, just being able to have the navigator affiliated with that office and responding to the crisis things. I mean, there's not a crisis going on every minute or every hour. I mean, sometimes there is, but that then in their if you want to say off time, they could be following up on resources and things, and not just that, but they can be in the field with someone and already be setting up follow-up with people in their own department. And so to me, that, you know, that how the you know, where that can lead is, you know, I don't know, but it other than that, to good things. So we're hoping to have, you know, the idea is to have the navigator, when they're not on a crisis call, be doing other things and following up and finding resources for people, almost to the point of, and this hasn't really been talked about, but you know, I always picture like someone driving around in a car looking for someone that might need help and pulling over and going, hey, what's going on? And then, you know, helping them get whatever they want. You know, I forget now, I think it was Laurie saying it, you know, the idea of trying to stop things before they happen. So there will be, I think there's going to be some good things with the, you know, just being under DBH's roof and having to be local where things can be followed up on immediately. You know, Jim even said, you know, that kind of like they could squeeze someone in right now, you know, if they need something right now, you know, that kind of stuff. So hopefully that answers the question. So yeah, how it's all going to come together is still an unknown, I guess, but we have our ideas on what we want to see, and of course we're open to ideas. But
I feel kind of lucky that this funding came after the consortium, the Behavioral Health Consortium, had been meeting for a while and sort of had an understanding, and it created some language between us all that was shared. One of the things that we recognize, Chief Nole?
I'm sorry.
Sure, Nole.
One thing I wanted to say too is, and then having, maybe I've already said this, but having them have the other navigator, you know, and having them both together, and I mean, it's going to be all working together, and then you know, we still want to partner with the city and Judd and all what they have going on. So it's going to be good, I think.
Yeah, I agree. Just to comment, I hope I didn't imply that there would just be siloing of different types of navigators. I totally see where they would work in collaboration. And you're right, when there's not a crisis of du jour, the crisis navigator would also be doing resource allocation. But it sounds to me like it's just an enhancement, and it allows there to be some focus solely on crisis intervention and some focus, or a lot of focus, on resource allocation. And it's everything every day. That's really how you handle people and their needs. So it sounds like it's a way to support the effort overall so that it's achieved even more successfully. It's already successful. So great.
Yes. I think there's an opportunity as we sit at the Behavioral Health Consortium table. We're always looking at the county system as a whole. And one of the things that we've recognized is that we have navigators and they all do good work. Sometimes the word navigator is a bit of a mystery word. It can mean one thing to one person or one agency and a different thing to another agency. I'm sure we have places maybe even where we've got navigators tripping over each other, that we have an opportunity to use this new program. The fact that we've got both the sheriff navigator and then this team of pre-crisis navigator talent, that we have a chance not only to use them to expand what we've got going on, but to cohere efficiently and optimize what we already have out there. And that's something, so when I say cohere and optimize, I mean, if Chief McKern has a call at a place where there is somebody who is in crisis, and then there are a number of families or other people who live on the property who it might be really evident are in a fertile place to be connected with services themselves, then we make sure that that happens, because we now have the resource for the crisis navigator to put it out to the pre-crisis navigator team and make sure that those folks are hooked up. And I want to make sure that that is happening down in South County, that they are deeply woven into how we set up this program. So my main focus was to introduce that in this meeting, to get you all thinking about it. Conversations are still yet to be had. Boundaries are still yet to be laid down, but to make sure that everybody in on this conversation is aware that it's taking a turn in this direction, and we'll try to keep you updated as things unfold. Was there anything else from anybody on that? Chief McKern, I'm sorry, I might have talked over you. I know you had to go off there. Okay, all right. Anyone else?
I might make a pitch really briefly, and Laura and I could talk about this another time, but the example you just gave, where you're going to do crisis intervention and then you notice that a family member needs something else that's related, but the crisis is not specifically about them in that moment. I've been in those circumstances many times as a nurse working in homes with families. And I've recently been in an example like that with environmental public health and all of their calls for solid waste management and hoarding and, you know, dealing with folks in their property and the issues going on with their dwellings, which is enormous. There's so much complexity in that situation, and it's really a social work, mental health intervention, often physical health of other people related to the incident that's brought the enforcement there. So I'm not making a plug for it right now, but all of these things are being looked at more holistically. And that's the bottom line, is that we have creative thinkers here who don't always just think within their lane, but understand that multiple lanes put together can really help people do more and be more. And in a preventative way, that helps all of us do our jobs better and have less, headache or heartache along the way. So it's hard to invest in prevention because you don't see immediate effects necessarily, but it really is rewarding.
Yeah. Okay, I know we're closing in on the end here. I wanted to end it on what I think is a good note. I'm sharing this slide. I happen to serve on the Affordable Housing Committee, and just recently there's some funding that went out, and it's specific to the Brennan area, and you guys might already know about it, but I wanted to let you know. And I see Trish looking hard, so I'm going to make this bigger. There was a $50,000 amount that was awarded from the county fund 148 fund, which comes from, I forget what, recording fees, I think. Fred Brotherton, recording fees. So 50,000 was awarded to Habitat for Humanity to help with some critical home repairs for 5 different homes down in Brennan. And I was excited to see that we've got some funding that's going specifically down to South County area in an area that I'm sure is really needed. And that's all I've got.
Why do they get everything? Why do they get everything?
They did not get everything.
Wait a
I'm happy they got
minute.
something.
Wait a minute.
I know.
Sorry, we can't hear you, Sheriff. Bye, see you later. Sorry, we can't hear you.
It's about time.
You're muted.
Wait. That was my Mickey Mouse voice.
And on that incredibly professional note, I'd like to close out this meeting. If anybody has questions, ideas for the next meeting, I appreciate your time here. If there are topics you wish that we were bringing to the meeting or that we explore, please let me know that too. Good luck with the drug take back.
Good to see everyone.
Bye-bye.
Hey, everyone.
Hi.